Welcome to Mad Medicine with Miss P. That's me. I did it again. I went into her room. Why do I do it? I should just walk. I should just walk past her room. I wish I knew how to post pictures. Like I feel like, oh, I'll post this picture here, but I don't even know how to work my phone, much less a camera. So I got nothing. But I I die a little inside. I After I cleaned off the rug, I picked up this beautiful shag Monsters Inc. kind of looking rug, and I shook it, and stuff fell out of it, like a lot of stuff, items, just beads and broken rubber bands and fingernails, and there's backs of earrings and other stuff that's stuck in it. That's probably never going to come out. I'm going to try to wash it, but chances are I'm going to have to throw it out, and I don't know what else to do. I can't take anything else away. She has nothing else to take away. I don't know. I can't ground her any more than she's already grounded. I give her tons of chores to do around the house, make them work with the horses, which for me would have been an amazing gift. And for my children who hate horses is torture. And I don't know what else to do. Y'all have any ideas? Give me some ideas because I don't. And if you say take her phone away, she doesn't have a phone. She's 11. There's no phone. I didn't have a phone at 11. She has no phone. Fortunate I wore my bottles of wine today because I think I'm going to need a shot or a bottle or so. Anyway, so like I told you, when I was done teaching what I knew to teach, I ran out of stuff. So this is all I have now. Just fabulous things that I get to write down regularly. Or my favorite thing is now my coworkers are sending it to me. And I got another coworker friend, a fellow nurse in another state that needs to start sending me her stuff too. She's an NP, so I'm going to bet she has tons of stuff. And I just got another one. I'll if I can get to it, I'll throw it in here. One of my favorites, I think, is of course I always come back to the allergy list. Now this is one of my favorites. She sent a screenshot of it to me because I don't know that I would have believed her if she did it. Not that she's not believable, but surely nobody would write in under list of things you're allergic to. Now, in their defense, it does say the useless things that are completely not necessary. Like I want to know what medications you're allergic to. I'm not going to administer peanuts to you. I'm not going to administer dander or pollen or cats or dogs or any of those things. We can't administer any of those things. But in their defense, it does say, are you allergic to anything? And I think it even says like foods and other stuff, which is completely not necessary for us to know. But at any rate, fine. But this one takes the cake. I can't think of a better thing to be allergic to. This person wrote in that they were allergic to summer. The season, summer. They're allergic to summer because it gives them runny nose, itchy eyes, and a cough. They're allergic to a season. So make sure when she comes in that you don't administer summer to her. I can't take anymore. I can't take anymore. I'm going to use this as comic relief because, let me say, I got two vehicles in the mechanics that has been there. One has been there for a month and the other we need to drop off as soon as possible. I've got, my number one barrel horse is lame. It's 1,000 degrees out, which my husband tells me every minute of every day how hot it is outside, as if I'm unaware. Just got a new AC unit. So if anybody needs a kidney, let me know because I'm selling one so I could afford the new AC unit. Thank God for my wonderful AC guy. Good God, he is the best. Shout out to my AC guy. I'm going to put on Facebook because he's just amazing. Megan, love, love, love your dad. He is phenomenal. Just came in, put it in, good to go. Can't wait. Haven't got the bill for that yet, but it's going to be fine. Everything's going to be fine. So whatever you do, don't give me any summer because I can't handle any more itchy eyes or runny nose. Okay, so this gentleman, a sweet guy, but I don't understand what you don't understand. This is how diabetes works. You don't make insulin, or you don't make enough insulin, or your insulin receptor sites are limited. There's a couple other little things in there, but for the most part, that's the case. So when you come in for surgery and you haven't taken anything for your diabetes, which we instruct you repeatedly not to do since you won't be eating. So you won't be ingesting or being introduced, your system won't be introduced to any additional sugar. We don't want your blood sugar going any lower, so you cannot take anything for diabetes. Seems pretty simple, right? So this gentleman comes in and his blood sugar is 170. Fasting glucose of 170, getting ready to have surgery. We'll be in and out of there maybe 4 or 5 hours, give or take, max. He was concerned that his blood sugar was going to drop during surgery. What would make your blood sugar drop? Well, I'm type 1 diabetic. Okay. That means that you don't have the ability to use your blood sugar appropriately and correctly and on time as the rest of us, because you don't have those either insulin receptor sites or secreted insulin to pull the glucose into the cell out of your bloodstream. How could your blood sugar drop? How could it possibly drop if you don't take anything to facilitate your blood glucose to get into the cell? There's, unless I am mistaken, there's nothing else that can do that. And he's like, well, it just does. It plummets. Then you're not diabetic. That's not how that works. And if you take insulin, she's like, if you require coverage or basal insulin, that means then you don't have enough, or you're not making it properly or correctly or on time, or it's not being received. Your blood sugar there's nothing that could make it drop, at least not significantly in a 4-hour period. Are you sneaking insulin? I said, do you have an insulin pump? He said, no. I said, then how could it drop? He goes, it just does. All right, maybe he is a complete anomaly, and I would like to suggest, I didn't, but I would like to suggest he contact the Guinness Book of World Records and see if he can't make a little bit of money with his backward type 1 diabetes or insulin dependent diabetes. How long have you been diabetic that you don't understand how diabetes works? I don't make it make sense. I can't. I don't. Okay. Then this other sweet little lady, and they're so sweet, and you know what? I'm sure there's more to it. They just don't know how to explain themselves. But this sweet little lady comes in and she's like, "Oh, you got to take a blood pressure over here because the circulation in this arm, isn't right." And I'm like, I said, "Did you have a mastectomy or lymph nodes, anything removed?" She's like, "No, there's this vein right here. Like if you put medication in it, it just comes right back down." So you mean if I put it in an artery? Because veins don't go away from the heart. Arteries go away from the heart. Artery, a way. It's kind of how you remember it. Veins go towards the heart. She's like, "Yeah, I know. I woke up during surgery because they used this vein." Okay. All right. I mean, maybe that happened, but do you have a fistula? If the medication went down towards your fingers, it would have gotten caught distally and maybe caused permanent damage, because medications can't seep into the capillaries and get into the tissue. Not most medications anyway, without causing some sort of issues. You all seen the Phenergan video I show. I'll just use the other arm. I would really like to know what actually is going on there. And not that there's not anomalies, not that there's not anatomical and bizarre congenital or maybe surgical accidental anomalies. Like one of my coworkers, when she finally held it together, she was laughing, she's crying. Oh gosh, she was so funny. This girl is so freaking, this sweet lady is so funny because she's just hilarious. And as she's trying to stop laughing, she says, a patient told her, and this was like the same week that I had this lady who thinks her vein is an artery. This lady said that, maybe it was a man, I can't remember. She was laughing too hard. I couldn't even understand half the words, but she said, you can't take a blood pressure in this arm because there's no circulation. I was in an accident, so I don't have any circulation in that arm. I said, did he have fingers? And she's like, oh my God, yes. So if you have fingers and they're not falling off or turning black, there's circulation. Now, could there be, again, some anomaly where you're not getting a good blood pressure reading if there's like a subclavian blockage or whatever? Yes, that those things exist, but you have perfusion in that arm if you still have your fingers, because otherwise they would turn black and shrivel up and fall off. I feel like a simple anatomy lesson, like just a quick little anatomy lesson is called for in this situation, like for everybody on planet Earth. We just have a little bit of an idea of how your body works, like just a hair might be a good idea, maybe. Oh, also, this is one of my favorites. I'm going to write this one down. This is one of my favorites. Dr. T and I love this one because, oh, look, this is still up here. Remember Metoprolol? Metoprolol. That is one of my favorites. This is one of Dr. T and my favorite. If you're allergic to something and you think it causes whelps. I haven't heard that till I moved here. We don't have whelps, I guess, in my previous state. Whelps. Okay. A whelp is what a puppy makes. It's a sound that a puppy makes. Those are called whelps. You know that, right? Those are puppy sounds. Whelps are sounds that puppies make. If you have welts, which means you're going to take this H and this P away, and it gives you welts. That means you're allergic to something. I don't think there's an H in welts. I think it's just, but whelps, those are sounds puppy makes when you cage them and walk away, or you don't pick them up when they want to be. That's the sound that a small canine makes. It's not something that comes up on your body, and everybody in this state thinks it is. It's not. Get a dictionary. Google it. Google it. You know, not that you're going to go open a book, but you can type it into your phone and you'll see what that is. It's not something that comes up on your body ever. Okay, so here's the thing with you women when we ask you for a urine sample for an HCG. And when you're like, oh gosh, I don't know if I can make an urine. I haven't had anything to drink. In what, 9 hours? You haven't had, it's 6 a.m. You haven't had anything to drink in what, maybe 10, 12 hours? You know the guy in 127 hours? I think it was 127 hours, right? James Franco played the guy. In fact, I just listened to the podcast about it. Someone just kind of reiterated his story where he had to drink his own urine. 127 hours. That guy was still making urine. He ran out he took one bottle of water with him. He's probably one of my previous patients. Took one bottle of water with him and set out all alone into the wilderness. I don't know who does that. I don't even want to go to the barn alone. Who does that? At any rate, sets out into the wilderness. 127 hours he's stuck there, loses his arm. He drank his own urine. You can come up with 3 drops for an HCG since you had as much as you wanted to drink less than 12 hours ago. You can do it. Give it a try. We're not doing surgery without it. You want me to draw your blood? We can draw your blood and spin it down if you want to. Or you can just pee in a friggin' cup. Quit acting like you can't pee. I can pee right now. I can pee on command. You're a woman. How do you not? I don't understand it. Okay, so in an H&P, I saw that the doctor wrote in that the patient had a heart bypass. They bypassed the heart. Maybe he has an LVAD. This patient could have an LVAD because that's what heart bypass is. They're bypassing the heart, which means they're not using the heart because you bypass it, like when you're driving down the road and you take the bypass, that means you're not going on that road because you're passing it, you're bypassing it and go. This was a doctor or an MA or God forbid a nurse in a doctor's office wrote that he had a heart bypass. You mean you had a coronary artery bypass? Like all you have to do is write CABG in there. Like we know what it is. I don't understand what a heart bypass. I don't think the guy had an LVAD, but all the time. Also, under surgery, car wreck, that's not a surgery. Having a car accident, that's not a surgery. It's You mean somewhere on your body was hurt? Oh, right. You had the somewhere on your body hurt surgery, right? Could you be more vague? Oh, no, it's impossible. Okay, just checking. Car wreck. It's the same as cancer surgery. Oh, you had the cancer surgery. I understand. Cancer surgery. My coworker also told me that this patient had an ablation. Nurses, follow me here. She had a heart ablation. It's not a cardiac ablation, but still, that's fine. She had a heart ablation, but now she has tachycardia on the bottom because the ablation fixed the AFib at the top of her heart, but not the bottom of her heart. She has bottom tachycardia, but not the top because the ablation didn't work on the bottom. And then when she tried to explain this to her, the patient told her she was wrong. So the nurse, and this is what we get. As I'm trying to educate this patient on the insane things they're saying, they want to tell you that you're wrong. Now, I have been wrong about many things and will probably continue to be wrong about many things, but there is a handful of things that I know pretty well. And after almost 30 years of nursing, I know what a cardiac ablation does, and I'm thankful that I didn't have to try to explain it to her, because you have to use your words very carefully. My other little giggly nurse who tried to explain to me about the circulation arm, she was giving me a rundown of the patient she took care of. I think it was Monday morning or Friday, the days run into each other, that the amount of shoulder movement in his limp concerned her. Like, she reenacted it, and I just went straight to Thriller. It was like straight up Michael Jackson. I didn't even know she could move like that. She's straight up Michael Jackson, the very beginning of the dance scene, when they're like kind of dragging their leg and doing that. I'm like, if you're moving your shoulders while you limp, I think you also have Parkinson's or something similar. You should maybe get that checked out, because that's not a thing. And then my girlfriend just also sent me, she just texted me today, I'll add this in before I wrap up, and she said that she sent me a screenshot, and it said, have you ever had a stroke? The patient said, yes. When? I don't know. And do you have any limitations from it? No. I feel like you would know if ever you had a stroke. I kind of feel like if you actually had a stroke, it's not really like a heart attack. Like, you can have this real mild, chest pain, heart attack, and you don't even realize it's happening. You're like, ooh, oh God, I'm glad that's over. Yeah, that was a friggin' heart attack. And that's like, you can have one of those, and we can see it on the EKG. And I can say, look, you've had a heart attack. And they're like, no, I haven't. I'm like, no, you have. Look, it's right here. I'm looking at it. It's right here. And then it'll even report out. And I've explained this to many students in the past. It'll say like atrial septal infarct, age undetermined. You had a heart attack. You may not have felt it. Like, I shouldn't admit this, but I woke up with light chest pain the other night. I'm sure it was nothing. I'm a nurse, so I'm not going to do anything correctly. I'm just going to walk it off. But like, that could very well, that was probably my heart breaking in my sleep while my conscious is meeting with my subconscious about how my little mini world here is falling apart around me, but it's fine. Everything's going to be fine. I got Jesus, it's going to be fine. It's just a little trying right now, but it could be worse. So that could possibly be a little mini MI. Let's hope not. But a stroke, you're going to know that happened. You're like, oh, right, okay. So at what point did an entire side of your body droop, go numb or paralyzed, or, significant blurred vision, loss of, speech, anything? When did that happen? Oh, you don't remember it happening? Okay. Well, then it probably didn't happen. You would know. Are there very mild strokes that, kind of go away quickly without leaving any limitations? Yes. They're called TIAs. Those are transient ischemic attacks. Transient kind of comes and goes. It was here, now it's gone. But a straight up CVA, when you're saying, yes, I had a stroke, or I like when they say mini strokes. It's like a mini fire. It's just a little tiny house fire. It's fine. Okay, that's still a stroke and still a concern, and probably means another one is coming, but all right. But this lady thought for sure she was positive she had a stroke, but didn't know how, when, or why, or doctor never said anything. They didn't do an EEG and, trace the electrical activity or anything. It's, or the damage or CT and see what kind of damage was done or anything like that. Neither was a seizure, but a stroke. But okay, whatever. I don't care anymore. I need to play the lotto or start Jenny Craig. I don't know. I need something. Okay, that's it. I got to get out of here. As always, 1,000 things to do. Thank God I already did my in-town stuff, so I don't have to do any of that. But as always, face your fears, forget your failures, follow your faith, and I'll see you next time if there is a next time. I don't know. We'll see how far this goes. Love you guys.